All right, we're gonna be doing the Thompson test. It's gonna test for Achilles tendon rupture, and basically what you're gonna do is you're gonna firmly grasp the gastrocolius and gastrocnemius muscle and squeeze. And basically what you're gonna look for is the foot to plantar flex, which he is. If you were doing this and he wasn't plantar flexing, it would lead to more tests to see if their Achilles is ruptured. I'm going to be doing the special test, Tinel's test, Tinel sign test. Basically, this is testing the peroneal nerve. You're going to do this test if you find weakness in muscle testing when they're dorsiflexing, plantar flexing, or everting. So basically, you're going to have the knee bent like so. Come up here, find the fibular head, and then you're going to take 2 fingers and percuss it. And a positive sign would be paresthesia running down the leg or just being in this area of the body. And that's it. Alright, I'm going to be doing the Kliger test. So basically what I'm going to do, I'm going to grab the malleoli, stabilizing the tibia and fibula. I'm going to grab first MTP and big toe. This is stressing the deltoid ligament, and also will stress some of the syndesmotic anterior tib-fib ligament as well. We're going to basically dorsiflex and evert the foot and work it with the different deltoid ligaments, trying to see if there's any pain. Alright, we're going to be doing the subtalar tilt test. First, we're going to grab above the malleoli, cupping the calcaneus. I'm going to be stressing the deltoid ligament by everting the foot. Then we're going to switch hands and test the calcaneal fibular ligament by inverting the foot. Alright, we're going to be doing the anterior and posterior drawer test, testing for the anterior talofibular ligament and posterior talofibular ligament. So I'm going to put my hand above the medial malleolus and shear down, testing the posterior talofibular ligament. And then switch hands, and then I will shear up, testing the anterior talofibular ligament. Alright, I'm going to be doing the clunk test, testing for the anterior and posterior tibiofibular ligaments for a syndesmotic ankle sprain. So basically what I'm going to do, I'm going to grab firmly right above the malleoli, cup the calcaneus, and basically do a shearing motion with a little bit of external rotation. Alright, I'm doing dorsiflexion range of motion of the foot and ankle, aligning the axis and the fulcrum up with the lateral malleolus, the stable lever arm going up the fibula and tibia. We're going to move the movable lever arm to where it's parallel with the 5th metatarsal. And I'm going to ask him to flex or move his foot like it's going towards the ceiling. Keeping the movable lever arm stable with the 5th. Then I'm passively going to flex his foot a little bit more. And he has about 20 degrees of dorsiflexion, which falls within the normal range. Alright, we're going to be doing range of motion. We're going to start with plantar flexion. So we're starting with the goniometer, going at the dorsiflexion, up the fibula in line with tibia and fibula. Axis is at the lateral malleolus. We're gonna start with the goniometer at 90. And then I'm gonna ask you to put your foot like you're going pressing on a pedal. So he gets to about 130 from 90, and then I'm going to passively stretch his foot down a little bit more. And he has about 40 degrees of plantar flexion. And a normal range would be 50. All right, I'm going to be doing a range of motion inversion and eversion of the ankle. Going to start with the axis at the attachment point of the Achilles tendon to the calcaneus, with the stable lever arm going up the midline of the calf and the movable lever arm at 180 degrees. I'm going to do inversion first, so I'm going to ask him to rotate the outside of his foot towards the inside of his right foot. So go ahead and do it. I'm going to passively flex. He has about 10 degrees, including passive, and the normal range is about 5 to 20. Then we're going to do the same thing, start at 180 degrees once more. I'm going to ask him to evert his foot. So can you rotate the outside of your foot towards the wall, please? I'm going to passively flex once more. And he has about 5 degrees of eversion, which falls in the normal range.